I'm Mary Renfrew. I'm the Director of the Scottish Improvement Science Collaborating Centre. We're an alliance of academics from several different universities, of practitioners across health and social care, of national organisations and local organisations concerned with the quality of health and social care, and also user and advocacy groups and policymakers. And we've come together to examine the evidence base for how you improve the quality of care sustainably and at scale. At the heart of our work, we have a question. How do we provide the best quality of care reliably for everyone in all settings? And how do we examine the best ways of doing that? So we have a number of different collaborative projects, some of them building on knowledge that we have already, and others taking innovative and different approaches. We're trying to look particularly at 4 different sets of outcome domains. So first of all, how do you create care that is safe and reliable in all cases and in all settings? How do you improve care and compassion in providing that care? Because we know that people's emotional and psychological health and well-being is just as important as their physical, clinical health and well-being. How do we reduce inequalities in access to care and in the way that we provide care, so that regardless of your background and regardless of who you are or where you live, that you still get good quality care? And how do we improve health and well-being as well as focusing on avoiding harm? So how do we actually create the greatest good? So those are the 4 sets of outcome domains that we are working towards improving. It's just as important for us to examine how care is given as it is to understand what care we should give. So however you're caring for people, that needs to be done with the respect and understanding of their emotional and psychological needs as well as their physical needs. For example, one of our studies is looking at how we increase care that parents can give to babies when those babies are in neonatal units. So very vulnerable babies, very anxious parents, and yet it's important that those babies get as much close physical contact with their parents as possible, because that helps both the attachment but also the baby's clinical outcomes and improving physical growth and development. So in that we have to look at how the care is given by the parents, how the care is given by the staff. And so we're looking at how you improve the quality of care right across, not only in the way that staff are delivering it, but also in what parents are doing. And so to improve care sustainably and at scale, which is what we're interested in, we really do need to understand the behaviour of individuals, of staff, of carers, of families, of the public. But we also need to understand the way in which the system works, so the whole organisation working together, whether it's a healthcare setting, a hospital or a primary care, or whether it's a social care setting, a care home, or indeed in people's own homes. So we're trying to work out the answers to making care effective and make that change sustainable, but also how that will be affordable for the health service and acceptable to everyone that's being offered care, so that their needs are met. It's quite a challenge, but we also know that with new and innovative ways of looking at how we do this, and by working together, that is absolutely the key issue for us, together to hear the views of people, the public, patients, carers, families, staff, policymakers, advocates, managers, everybody across the system, putting that together with the views of academics and experts in the field, that together we will actually be able to solve many of these challenging and intractable problems, that we will find solutions. So thank you for those of you who are already working with us. we look forward to working with many, many more of you over the coming years.